Welcome again to Kano Iwanyayi broadcast. This is Sangwazi Spiwe Kachinza Mapumo. I'm back. Today, I've got, this month is a very special month. I'm sure you all are aware of it, Breast Cancer Awareness Month. And this is so important to all of us, both men and women, to know what does that mean? What is the awareness all about? So I brought you Dr. Nomsa Tsikai. She's an oncologist. At Cancer Care Network Zimbabwe. So she is a specialist in cancer. So she'll be here to talk to us about cancer. She's one today. She's our guest speaker or guest on ordinary people doing extraordinary work, because awareness is very important to us. Welcome, Dr. Tsikai, to our program.
Thank you so much, Spiwe. It's lovely to be here.
Good. So I know it's a very, very busy month for you, because I see you're on webinars, you are on talk shows, you are on all kinds of things, because this is your area. Now, as I said earlier on, it's breast awareness campaign, or awareness month. What does it really mean? I want you to break it down to us ordinary people. What does it mean? Because breast cancer is now become a very common thing in our midst. It's something that when I was growing up, we didn't even hear much about it, or maybe because we didn't know. But I have a feeling, I don't have the statistics to that, but I think more and more people are being diagnosed with breast cancer. Go, tell us, what is it?
Thank you so much. Yes, you're right. Definitely, breast cancer is something that is on the increase, affecting a lot of women worldwide. It's one of the top most common cancers that are affecting women. So we find that we have a lot of women that are being diagnosed on a daily basis. And also, the unfortunate thing being cancer, we are also losing a lot of women to breast cancer. So, one of the reasons we have dedicated the whole month of October to breast cancer is because it's that common a disease that's affecting too many women, that therefore we actually need to raise awareness on this cancer. We need people to know how they can prevent it, how they can screen for it, how they can catch cancer early. What we mainly advocate for is screening and early detection. With cancer, it's always when we catch it early that we have better chances of curing. So our main mandate is to change, when you hear that you're diagnosed with cancer, a lot of people are afraid. They associate cancer with death. So the main problem with that is when we catch it at advanced stages. But now we are very lucky that we have screening measures for breast cancer. So we want to actually change that narrative. Early detection actually does save lives.
That's very important, because, as you said, a lot of times you hear that, and people, what they see is death, and not realizing that early detection is it's important, because it really can increase the chances of survival. Right?
That's so true.
But what I am not so sure is what mammograms. I know it's very important. I am talking to you from a different world altogether, where mammograms, I live in a country where healthcare is free, so that's easy for people to go. But even here, I know a lot of women who are not even aware of, even though it's free, that they can talk to their doctor and go, whether it's annually when they go for their healthcare or their health test, to also have a mammogram done. What does it look like in Zimbabwe in terms of mammograms for people?
Yeah, so mammograms, we're using these for screening. And I'd like to just mention that we're actually lucky to be living in an era where we have the mammograms. When you're looking at many decades back, centuries ago, there was no mammogram. It is a relatively recent invention. So it's technology that we are very lucky to be living in a time where the mammogram actually exists. So the mammogram is very beneficial because it's a special X-ray that looks at the breast and looking for early cancers. So we are looking here at tumors that are usually less than half a centimeter, 5 millimeters or less. So when we catch these small lumps, chances of them having spread to nearby lymph nodes or other parts of the body is really very limited, which is why women that have regular mammograms are actually surviving, and they're cured of cancer, a lot of them. So with this mammogram, there is still a lot of ignorance out there, especially in Zimbabwe. I still find when I get a new patient and I'm taking the history and I ask, "Oh, have you been having regular mammograms?" Somebody can even ask, "Oh, what is a mammogram?" So, which is showing that the word hasn't quite gone out there and reached everybody. And some women will be like, "Oh, yes, I know about mammograms, but I was too afraid. Why should I look for something that is not there?" So, the fear also has been an issue. But definitely, what I always say to people is let's not live like we're living in the dark ages.
True.
Where women were known to, they would know that some women were unlucky to develop these breast lumps, and nothing could be done about these breast lumps. If they were lucky to have surgery, they would have surgery. But what they would find is after some time, a woman now has yellow eyes because the cancer has spread to the liver. A woman now is not breathing properly because the cancers were being found tumors as lumps, so they were being caught late. But when they discovered the mammogram and started picking up these tumors earlier, we're able to actually stop that problem of the cancers deteriorating to affect our liver, our lungs, the spread. So we're actually able to catch the cancer early. So I always advocate for mammograms.
Now, we are talking about screening of people, women going for screening. What
Mhm.
is it that happens? Maybe let me put it that way. What causes these lumps to develop in people? Because we need to be clarifying this, because some people might think it's because of something that you've done, or
Mhm.
something that's, I'm not understanding what it is. And sometimes people put this into our African tradition. Something has happened, waroiwa or something. What happens when someone develops a lump in their breast? What would have happened?
Yeah, so these lumps are really part and parcel of us as human beings. Our bodies are known to actually go through these changes that what we call cancer. So almost on a day-to-day basis, I always say all of us have cancer cells that are growing, but we are lucky that we have strong immune systems that actually undergo surveillance of the body, pick up any abnormal cells and mop up, they clean up our system. But at times, our immune system, for whatever reason, fails to actually pick up that there is something abnormal happening, and the abnormal cells are able to continue growing and they are not removed from the system. So, the cause for these abnormal cells to actually start growing is due to what we call mutations within our genetic makeup. So, it starts within one cell that undergoes this mutation or mistake in the DNA. So within the breast, we're saying the mistake would have happened in one of our breast cells. Some people are unfortunate to be born with this mistake, with this mutation. So they are at a much higher risk of developing breast cancer, especially people that are born with the BRCA1 or 2 mutation. Their risk is much higher. Therefore, the need to actually know your family history. I always advocate for people to know when there's a family gathering, or just to make an effort to find out what cancers are running within our family. You might find there's a strong family history of breast cancer, but unfortunately, breast cancer is not just associated, the risk is not with breast cancer alone. It may even be a family history of ovarian cancer, uterine cancer, colon cancer. So just know about all the cancers that are occurring within your family. Sit down with your family practitioner and they will take you through a risk assessment. So, besides a genetic or inherited risk, which is usually about 10% of the cancers that are inherited, the rest are acquired. So, we get these as wear and tear on our cells as we get older. The damage then occurs that can cause these mutations to occur within our cells, causing that uncontrollable growth. So, these mutations,
Mhm.
so
Yeah.
these mutations,
Go ahead. Go ahead.
Thank you. These mutations are due to, as we get older, just wear and tear on our bodies. And for us women with breast cancer, we're looking at hormonal issues. When we delay getting pregnant, we recommend women to have at least their first pregnancy at the age of 26. That has been found to be beneficial. We're also recommending breastfeeding for at least 1.5 years. It also breaks our menstrual cycles, our estrogen cycling, which can also be beneficial to reduce the risk of breast cancer. We're also finding that our lifestyle issues are increasing the risk of us getting these mutations. So things such as obesity is quite an important one. It's been associated with breast cancer, colon cancer, and other cancers. So as women, we actually have to be wary and beware of our weight and our height to check to see is our BMI within an acceptable range and not in the obese category, especially for postmenopausal women. These are women that are no longer having their menses. Obesity in the postmenopausal stage has been associated with breast cancer.
That's very interesting because I wasn't aware of that myself. I mean, this first time I've heard about that. That I know. I mean, we are supposed to watch our weight and I didn't realize that it could actually lead to that, put us in high risk of getting cancer if that's not addressed. And yeah, that's a learning curve for me, and I'm sure a whole lot of other people. What are the lifestyle changes that can we make to maybe reduce the risk of getting HIV? I keep going to HIV because that's what I've been working with all the time with cancer.
Yes. So that one main one, like you're mentioning, to reduce obesity, that comes with exercise. Exercise has also been shown to reduce one's risk of developing breast cancer and other cancers. So here we're looking at moderate exercise, 30 minutes a day, five times a week, has actually been found to be beneficial. It will help with your weight, but also it will help to reduce risk of cancers. And with that, also, we're looking at diet, all tied in with obesity, the exercise, all tied in. The diet also is another major thing, especially here for us in Africa.
Mhm.
Cancer, was never really something that was that common, but unfortunately, we have adopted eating habits that are foreign to us. And with that has come in fatty food, processed food, sugary foods that have all been associated with an increased risk of developing cancer. So we really have to watch that and go back to our traditional eating, our natural and processed foods, eating vegetables, fruits, that we always used to grow in the rural areas. We had that in abundance. So we just need to go back. And in Zimbabwe, especially, we've got an abundance of sunlight, rain, fertile ground. So we always advocate for people to just, to encourage them to eat the more natural foods. Fruit also is actually quite beneficial. So here we're saying our vegetables and fruits have special nutrients in them that actually mop up toxins from our body. They have antioxidants, the nutrients that they have, minerals, vitamins that go around the body and mop up the excess toxins, the toxins which may have then caused cancer. So our fruits and vegetables are quite important. With that, also water drinking. A lot of people wait to feel thirsty before they drink water, but we recommend water,
Water,
lots
water.
and lots of water.
That's
Yes,
well, I suppose it's quite easy for people to just get some juice, which again we go to gravitate towards sugary stuff, which, as that
exactly.
you are saying, it feeds these things in our bodies, which is not good.
Exactly. That is so true. And also along the lifestyle factors, we're talking about things like alcohol drinking, cigarette smoking. A lot of these things we do without thinking. It's just things that we know. Oh, yeah, after work, I'll go and have a beer, wine just to de stress. But without actually realizing that when we're doing that over and over again on a daily basis, the effect that it has on our bodies. So cigarette smoking is a definite no-no. I mean, cigarette contains more than 200 carcinogens, which are cancer-causing agents that then, just go around the body, in our system, in our lungs, causing wear and tear, causing damage. That damage then causes those mutations and the cancer process. So cigarette smoking is not good. And I always tell people that even if you are in close proximity, you live with somebody who smokes, make sure that you're not also inhaling secondary smoke. That's passive smoking. It's also equally, if not more dangerous.
It's very that passive smoking. It's actually it's disturbing because more so when you live with somebody who smokes, and you do the best you can. You wake up in the morning, you go to the gym or you go run, you get exercise, you drink your water, and you live with somebody who smokes. and they says it's more dangerous, and that's just really quite um an unfortunate situation that people should look into and make decisions that are wise decisions about their relationships, or with family or friends or someone who is close to them.
Yes, that is so true.
Mm.
Just also along the lines of these social behaviors, alcohol drinking. Yeah, alcohol drinking is a bit tricky, that one. I think.
But you know what? You need to talk about it, doctor. Speak, speak, speak. We need to hear this, because this is something else, having a little drink, but sometimes it's quite excessive, that one should look into it and say, I drink every day, I smoke every day, and I eat fatty stuff every day, and I don't eat vegetables and fruit. That on its own is a potpourri. It's a dangerous combination of stuff.
Dangerous mix. That is so true.
Mm,
Yeah. So, alcohol drinking, I always ask people, why do you drink? A lot of people have never sat down to understand, or to have a good enough reason. It's just something that they just started doing when they were young. And they're saying, oh, it helps me to relax, to de stress. But yeah, when you're thinking about it, what are you gaining from that alcohol drinking? Can you
mm,
not find a healthier way of de stressing? Going for a walk, listening to music, meditating, just sitting and having a cup of coffee with a friend. Why does it have to be alcohol? We always have to really sit down and ask ourselves why. What do we benefit from it? Because alcohol drinking does definitely increase the risk of cancers, breast cancer plus colon cancer and other cancers. Traditionally, they always used to say 1 unit of alcohol is safe for a woman and 2 units of alcohol a day for men. But I've just come across recent literature that is saying now, no, not even a little bit of alcohol is guaranteed to be safe, no minimal amount. So, just for people to know that even that 1 unit that we were allowing you is also not a guarantee that
mm.
you are safe. So, just to stay away from alcohol completely if you can, it's important.
You know,
And
mhm.
mhm.
People can. I mean, if you say if you can, it's like, okay, the choice is yours, which I respect. You're a doctor, right? But really, bottom line is, people should stop drinking. It's just like any other drug. It's just that we're socialized to
Mm.
think drinking is okay. It's not as bad as taking meth, but I think the effect is the same.
It's true. It's so true. That's the issue with alcohol, that it's socially acceptable.
Mhm,
Especially in Zimbabwe, it's a big thing. Alcohol drinking results in a whole lot of other issues, car
mhm,
accident, and all
mhm,
sorts of things.
mhm,
Yeah. And, we do have people that were now saying, okay, I will save my 1 unit a day and then binge drink at the weekends. Have 7 on
of
Friday.
course. Oh my goodness. Yeah,
That is
that,
definitely not
mhm.
acceptable. Binge drinking is a high risk.
It definitely is. And you see, because when one binge drinks, they finish the whole bottle of wine. One person would finish the whole bottle of wine. And when that's happening, one doesn't realize the risk they're putting themselves. They are increasing the risk of a lot of other things that come from non-judgment, or you can't give proper judgment of things, and get
Mm.
yourself into stuff, accidents, etc.
That
Like,
is so true. Yeah.
I'm just gonna ask you, what now, like in rural areas, I'm not sure how your awareness, or raising awareness in those communities, what is it looking like? And like rural clinics, is there anything to and to teach women in rural areas the importance of early testing, early detection, and mammograms? I'm sure they don't have. What does it look like?
Yeah, the rural areas have been a bit of a challenge,
Mhm,
but we do have organizations that do go out and do outreaches and teach the women. What we're mainly relying on is breast self examination for
mhm,
our rural women, because things like your mammograms, they cannot afford. And unfortunately, we don't have these in our state or government hospitals. So we're teaching women how to examine their breasts. when to do it, recommending that they do it monthly. So they're
Mhm.
really getting to know their breasts so that when they do find a lump or some sign that there may be a problem, they quickly get assistance. Because we still see a lot of women that say, "Oh, I had this lump. I noticed it 3 years ago, but it was not painful. So I thought it was just a pimple and I ignored it." There's
Mhm.
the ignorance. But when we're teaching them to get to know their breasts, to examine them regularly, then, they're more empowered that when something comes up, they quickly get assisted and get help. But we still need to do a lot more to have the imaging available, the mammograms, because those have definitely been shown to make the difference in terms of catching the cancer at much, much earlier stages where it's more curable. Mm.
Um, so there are no government mammogram centers where people can go for testing.
No, we do not have those in Zimbabwe. So we have found that the private centers have really come on board,
Mhm.
really been very supportive. A lot of them this month of October are offering free breast examinations, free mammograms. Some are offering discounts.
Mhm.
So, which is now helping to, give access to a lot more people. So, most of the private centers have some
Mhm.
sort of specials that going on. So we're very grateful for that.
I'm just wondering in terms of the cost. I know you, but I don't know if you can give me just a rough of how much it would be for somebody who wants to have a mammogram done.
Um, yes, yes, it's averaging around 100 US dollars,
Mhm.
depending on the technology that is being used. So we have our old 2D, two-dimensional mammograms, which are cheaper. And then nowadays, we're lucky enough in Zimbabwe to have two centers that are actually offering three-dimensional mammograms, which are much more sensitive, much better. So those are a little bit pricier. But at the same time, still they're offering discounts this month of October.
Okay, you broke a little bit there. I don't know what's happening, but it was breaking. But that helps. I mean, you know what? I kept thinking, how much wine does one drink in 1 month? And if you put that together and go for a mammogram and skip your 1 month of booze and getting some wine and drinking with friends, I think it's a good investment right there.
Yes, that is a good way of looking at it. It's always very tricky when you're weighing some of these things, where we utilize our money, our finances, yeah, what we put value on versus things that are actually more valuable. And we think they're
Exactly.
too expensive. Yes, you are so right.
Exactly. I know that the times are tough and money is just not there, but you still get people drinking. You still see people boozing, and you ask them, so, "Oh, I don't have money to go for something like that." But then if you just trying to quantify how much you're spending there, but anyway, that's another story. Another story. So, I read somewhere that breast cancer is not only women. I suppose it's a more obvious because we have we have breasts and so do men. But I understand also there is a certain increase of a certain percentage of men who are diagnosed with breast cancer. How is that?
Yes, that is so true. Yes. So 1% of breast cancers occur in men. So a lot of men, when I tell them that, I go and do presentations at men's conferences, they're like, how can I have breast cancer? I don't have any breasts.
I know.
Unfortunately, men also have breasts. They're born with breasts. It's just that at puberty, they don't grow as large as, with women or girls at puberty. But it doesn't take away the fact that men have breasts. And as long as you've got breast tissue, it actually can become cancerous. It's also more important for men to know their family history because for some
Mhm.
of them, it's actually a genetic risk that they were born with, the BRCA mutations. So it's very important for men to know family history. And also the challenge that we face with male breast cancer is because of lack of awareness and that appreciation that they have breasts. When they do feel or see a lump, they think it's a pimple that
Mhm.
is there. So they,
Mhm.
they just ignore it. I mean, they totally ignore it. And unfortunately, a lot of the places where you have to be tested for breast cancer, they are women, the well woman clinics, they're women clinics.
Exactly.
So, to go in there and say, I've got something on my breast, no, the stigma associated with it. So it's a well known thing that men present with advanced breast cancer. So we really need men out there to know that they have breast tissue, they can develop breast cancer. So if you do see a lump in your breast or any rash or abnormal, or you're seeing your nipple discharging blood, to quickly get checked because it may be breast cancer. The sooner you get it checked out, the better.
You heard Majins Viravarume. This is also important because, but they don't have to go for mammograms like we do. But if they notice something, right?
They have to, yes. If you notice something, so that means regularly, once a month, also just get into the habit of, feeling your breasts, that
Mhm.
self-breast examination, so that because some of the lumps may be actually deeper within your breast. Some men have bigger breasts, so you may not actually see it as a visible lump, but you actually have to feel it. So that self-breast examination, men also please, those with partners, encourage your partner to just check your breast as well. That may save your life.
Now, tell me, we've got 4 minutes left. Tell me, what would you say the common symptoms on any woman, other than the lumps? What else do they should we look for on our breasts, on ourselves, and yeah.
Hmm. I always like to just stress that let us not wait to feel lumps, to see any problem, to feel that discomfort. We need to go for screening first. Screening means looking for cancer before you have any symptoms. When you're fine, absolutely fine to go out of your way to get checked. Okay, but it's still important to be aware of the symptoms. So the lumps that you mentioned, these lumps also, you need to look out for them, yes, within the breast, but also in the armpit. We do have quite a number of women that come with breast cancer, but presentation was a lump in their armpit. So those are lymph nodes or lymph glands. That small tumor, but it has already spread to the lymph glands. Don't ignore any lumps in the armpit. Some people will just say, it's a lump in the armpit, it's an abscess, imota. So they ignore it. But still, you must get it checked out. Then we're looking at, as you are doing your monthly self breast examination, we advocate that you look in the mirror. So in the mirror, you are knowing your breasts, what they look like. So a lot of women have breasts that are asymmetrical. You just know, my right breast is a little bit bigger than the left. Yes, but if you're in that habit of once a month looking at them, you get to know them. So when there is even a slight change in that size of the breast, you're able to quickly pick it up. You see one breast growing bigger than you're normally used to. That may be a sign that something is growing inside that breast. As you're looking at those breasts in the mirror, you may see some skin discoloration, skin changes. It may be a sign that something is happening underneath. So also quickly get that change looked at. It may be for some women, the skin is discolored, or there is an ulcer or a sore that develops on the skin. It may be a rash. It may also be, like an orange peel
Yeah, yeah.
appearance. Yes, that may be a sign that there's something drawing on that skin, the lymphatics of our skin, causing that orange peel appearance. You also need to get that checked out. We also want to look out for nipple discharge. So if you're seeing, when you wake up in the morning that there's a nipple discharge on your on your nightgown, it may be that something is happening within the breast, especially if it is a bloody, spontaneous discharge. But at the same time, when we're doing our self breast examination, you can just gently squeeze your nipple to see if there's anything that comes out. Nipple also very important. A lot of women come in with nipple inversion. The nipple looks inwards, it's turned inwards or is drawn inwards. Nipple retraction may point towards a tumor inside that is pulling that nipple backwards. So that can be a sign.
Thank you. So, oh, I tell you, I think we've anybody's listening, we've learned so many things that we don't do. We don't really respect not respect our girls, but to have a look and getting to know yourself, because there are so many things like Dr. Tsikai has said this today, that we ignore, and the girls are there, they're there for feeding the babies, and after that just wash them, put them in the bra. But I think it's important what you just said, that take some time to look at them and see what's going on and touch them and feel them. And if you can afford to go for a mammogram, to constantly go and see your doctor and go through all this. And girls, we heard about alcohol consumption and walking and exercising and the food that we eat. It's a lot, but it's a lifestyle change that could help. That could help. And thank you so much for coming to us and talking to us as one of our ordinary people doing extraordinary work in our communities, talking about things that matter to everybody, and making a change in our community. We thank you so much for that. And for anybody watching and listening, please like, share, and subscribe to Kano Iwanyayi broadcast. We'll be seeing you again next week with another ordinary person doing extraordinary work. And from me, Sangwadzi Spiwe Kachizama Pumo, have a lovely day, a lovely evening. Thank you.
Thank you, Spiwe.